Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to another Lunch and Learn in our ongoing Financial Friday series. Sainies is excited to offer these sessions in cooperation with our corporate partner, AXA. AXA has a long-standing presence in New York, and a large portion of AXA's New York client base is built upon the work they do within the public education system. Through AXA, Sainies members can receive competitive insurance rates and a full array of retirement services, including a complimentary financial profile for Sainies members, which we urge you to take advantage of. This is a great benefit. Our AXA presenter today is Greg Ronenberger, AXA Advisors Regional Vice President. Before we get started, please note that participants are muted during this session, but we will have some question and answer time following the presentation. If you do have a question, just type it within your control panel. We're also recording the session, and it'll soon be available at sainies.org, and I'll email all registrants with a recording link as well. With that, I'll turn the presentation over to Greg.
All right, thanks very much. And can you hear me, Annika?
Yes, you're good to go.
Yeah. All right, wonderful. Thank you. Sometimes I do these and I talk by myself for about 5 minutes before someone tells me. Well, thanks everyone for joining. Happy New Year to everyone across the state. As was mentioned, my name is Greg Ronenberger with AXA. I am in the Syracuse office, so right smack dab in the middle of New York State here. And we do offer a financial consultation for all Sainies members that I will say is not as, more people aren't taking advantage of it as we think should. So we do want to definitely make sure you're all taking advantage of that. If you haven't done so, let us know. And also, the long-term care aspect is something that we definitely do take into account as we're doing those plans for folks. So in going through the presentation here, just a couple of notes. Essentially what it says is I'm not a tax advisor or a legal professional, so I don't provide any of that type of advice for you. But what we're going to do today in the, call it 25 minutes or so that we have here is really talk about some of the basics of long-term care. It's really not designed to give you every piece of information, but just act as a primer for you to hopefully get armed with some more information and then start to take some action. So a couple things that we'll cover: what long-term care is, who needs it, how should we address it within our financial plan, and then most commonly people ask us about the insurance option. Well, what should we be doing there? So we'll talk a little bit about that as well. I will say that as we're looking at long-term care planning, for folks on opposite ends of the financial spectrum, meaning those that are wealthy, and when I say wealthy, I'm talking about people in the, call it $1 million to $2 million asset bracket and above. Those people typically don't need long-term care insurance or much planning because they could self-fund on their own. Conversely, those on the lower end of the spectrum, those that are in the, we'll call it the not wealthy category certainly, but those that are kind of low income families don't really need long-term care planning because typically government assistance will take care of them. However, for those in the middle, which is pretty much everyone on the call, I would assume, now some people might be wealthy from other assets or family businesses or things of that nature. I don't want to assume, but nobody on the call here in the state retirement system is going to qualify on the lower end of the spectrum because of the pension and Social Security incomes you'll have regardless if you save anything. Those incomes will put you out of the age or the income bracket for receiving some government assistance. So pretty much everyone on the call probably will need to address this through a planning process. And to really highlight the need for this, some of these statistics are pretty mind-boggling here. Excuse me, when we look at life expectancy. So you can see the way to read this chart here is that if we look in this category here, this is for someone who might be born today. So this the report is from July 2018, so it's fairly recent. But someone born today, say a female born in 2018, has a life expectancy of 81.1 years. So we could expect if someone's having a daughter right now to live that long. However, for someone who's 50 years old, a 50-year-old female today has a life expectancy of 83 years. So someone age 50 today has actually a longer life expectancy than somebody born today, which is pretty crazy to think about. The challenge becomes as we get out here into these later years in life, what is the quality of life and what type of support will we need from a health standpoint? That's something that we really have to take a look at. So again, some additional statistics here. At age 65, once you hit 65, it's kind of the magic number where half of the population in America that is 65 will need some type of services during their lifetime. So it's something that is real and something that definitely does need to be addressed. Now, what does it actually mean for long-term care? Most times people think of long-term care as nursing home care, and certainly that's part of it, but it's not all of it. There are a number of different types of care that people might need, and really it comes to a point where someone can't function completely independently on their own. And many of us have had family members that have been in that category where someone needs to check on them once a week or once a day. Someone needs to just make sure that they haven't fallen down or taken ill, or make sure that they're remembering to take their medications, things of that nature. I mean, these are all limitations that would qualify someone to say, hey, this person needs some type of long-term care. And again, the purpose here, as you can see, is maintenance, not a cure. So it's not something like you would look at in a medical situation where somebody has a debilitating disease and we could, all right, take care of them, cure that person, and then they come out of the hospital or come out of the treatment. This is something that really is an ongoing and doesn't have any type of end date to it. So the different levels of care that we look at are these three here: custodial, intermediate, and skilled care. And I'll run through what these mean very briefly. Custodial care is provided to someone that can't perform 2 out of 6 what we call activities of daily living, and I'll show you what those are on the next slide here. But custodial care does not require a licensed medical professional to provide that care. So this could be provided by any what they call unskilled medical professionals, or really a family member. That's the key there, is that if someone is in their home and a family member needs to come and check on that person on a regular basis, that person can be seen as receiving custodial care, and that is a long-term care benefit, even though it's not a medical professional that is offering the support there. Intermediate care is someone who needs some type of care. It's supervised by a medical professional, so a doctor, physical therapist, but the actual the treatment is provided by a nurse or a nurse's aide, or someone that doesn't have as high a level of licensure. So as you could imagine, someone that doesn't need care provided by a doctor, that could be provided by a nurse, nurse's aide, would be less costly than someone who needs the full skilled care here. The third bullet, so skilled care, as you're following along here, you could probably guess, is care that has to be provided by someone with the highest level of licensure, such as a doctor, registered nurse, or a physical therapist. So certainly, as you go down the line, the type of care is a bit more extreme, certainly, and a bit more expensive as well. So what are those activities of daily living? These 6 things right here. They're pretty self-explanatory. Here, bathing, continence, which I was just described as being able to hold it until you get to the restroom. Getting dressed, feeding yourself, making sure you could prepare meals, things of that nature. Toileting is not the same as continence. Toileting is actually getting on and off the toilet. Sorry to be a little graphic here, but this is real life. And then transferring is really moving from place to place. Specifically, being able to get out of bed and over to a chair, or being able to move from, say, the living room into the restroom, things of that nature. So if anyone cannot perform 2 out of these 6, and that is from a doctor's supervision, and they take a look and they say, yes, you cannot perform 2 of these 6 things, then you qualify for long-term care. And then again, it's just which level of care is required. Another area that has been added to this, which is sort of separate from this list of 6, is dementia. So sometimes people might be able to do these 6 things, but they might just forget to do them. Or if you've ever had someone with with dementia, my grandmother did back in the day, and she required some care because she was on her own in a different state, and she just couldn't remember. I mean, it got to a point she didn't really remember anything. But early on, it was, not remembering to take her medicine, or not remembering when she goes out and forgets where she was going to. And the danger is you forget how to get home. You forget, where you're from, where you live, you go to. We've heard stories of people that have gone to a home that they lived in 15 years ago, and someone else answers the door, and there's a lot of confusion, certainly, and concern there. So dementia has been added to it, and it's just something that is definitely more prevalent now than it was, say, 15, 20 years ago. So as we mentioned, the delivery of the care, it's not just nursing homes. It can be done in your home from someone who's skilled or unskilled. There are a lot of different facilities out there, and this kind of goes in order of from the least intensive to the most intensive there. Certainly a nursing home would be a full-blown, okay, you need round-the-clock care. But they have a lot of different types of facilities out there, which are really good for folks that are retired or planning for retirement. And you might look around and you say, well, we've got the old 4-bedroom, 2.5-bathroom house. It's 2,500 square feet, and kids are out of the house, and we're retiring, and we probably don't need this place. Where should we go to? Well, sometimes people don't want to move again and again and again, certainly as they get into retirement and as they get older, but maybe taking a look at some of these facilities here, these independent living facilities or continuing care communities where it doesn't feel like a nursing home, but there are people that it's independent living, but people just come around and check once a day or once in a while, really depending upon the type of oversight that somebody needs. So as they need more and more oversight, more and more care, the facilities are able to provide that additional level of services without having to continuously move from place to place. Now, it might come a time where we've got to skip a couple of bullet points, and we might have to go from, say, something like this all the way to an Alzheimer's center or something. Well, obviously, you can't avoid that, but it avoids or affords a nice transition for somebody as they're thinking of, hey, what are the next stages going to look like from a living standpoint? Now, looking at the cost, certainly the cost of care is not inexpensive from a nursing home standpoint. And I'm just going to go to the New York numbers here. And when we look at the New York numbers, and this is a fairly up-to-date representation of what they look like, depending on where you're at. So I am physically smack dab right here in the middle of Onondaga County. And in my region for a nursing home would be $120,000 per day. So you can see based on all of these numbers, all these regions, I guess you could say I'm fortunate in that I live in the least expensive area for it. I've got this wonderful lake up here that provides me a lot of snow and issues there. However, if I'm looking on the bright side, in 30 years, I'll be paying less for long-term care than anybody else will, which I don't look at it that way because I've got way too much time on my hands to think about it. But in looking at what the costs are, you saw the national average is about $100,000. In New York, it's anywhere from 20 to 50% over that number. Now, some might say, well, hey, here's another great reason to get out of New York State. Certainly, there are a lot of considerations around that decision, but a potential suggestion or maybe it's not really a solve for the problem, but to help out with the problem. If I live in this area here, in why Rochester is so much more than Buffalo, Syracuse, I have no idea. It's just the way it is. But if I'm living in this area in the Rochester region, maybe do I move a couple counties over, or maybe do I go out of state and decide to live someplace else and then cut my care down by, potentially $30,000, $40,000 per year. That number is very surprising to me. But you can see pretty much as we get down into the lower area of New York State and certainly into New York City, Long Island, the costs do spike up quite a bit. Now, keep in mind, those are today's numbers here, and that's just for assisted living facilities. Sorry to double click that. Assisted living facilities, I don't have New York specific numbers, but nationally, you could see they're a lot less because there's a lot less care that's provided, which that should be fairly reasonable to assume that. However, do realize that the numbers I'm showing you there are today's numbers. They are not tomorrow's numbers. So if you look at the average cost, if right now it's $100,000 today, if someone is 50 years old on the phone right now, there's probably 20, 25 years, 30 years maybe until you need that type of care. The cost, of course, is going to increase. This is based on a 3% inflation rate. However, if you look at the average cost increase over a 5-year time period in the early last decade, the average annual cost increase was about 3.5%, not 3%. So healthcare costs are rising. It's unfortunate, but they are, and they're rising faster than the rate of inflation. So we need to plan for this and compensate for some of those things. So that's all very joyous information. All right, that's going to cost us an arm and a leg, and why even bother getting to retirement? Well, there are some solutions on how to finance long-term care. We're going to go through a few of these things here. Number one, Medicare. This is a very misunderstood solution, I'll say, or perceived solution for long-term care, because people will assume that, well, I'm on Medicare, so that'll pay for everything. Well, Medicare is really, it's like your health insurance. It's designed to get you taken care of, get you out of the medical facility and on your way. So it's more as we talked about before, long-term care is more of a maintenance, not a cure. The Medicare is more covering cures. So if you're sick, they'll get you better. Medicare covers what they term medically necessary skilled care for a limited amount of time. So basically get you back up on your feet and get you out. Generally speaking, Medicare will cover for up to 100 days. So just over 3 months. So while they'll pay for some things in the short term, it's really not a long-term solution. Some people will ask about Medigap plans, and a Medigap plan is something where with Medicare, you might have a deductible on your any type of coverage, on your vision or dental coverage or something of that nature. So a Medigap plan will just pay for those deductibles or any costs that are over and above what basic Medicare will pay for. But if Medicare doesn't cover a service, Medigap will not cover that service either. So if Medicare doesn't cover long-term care stay past 100 days, Medigap is not going to cover that as well. So really, Medicare is not the solution for long-term care. Conversely, Medicaid, is not as well. Again, Medicaid is for the unfortunate, the poor, essentially, is what it is. It's welfare. It's the welfare system. And again, all of you on the phone here, if you're going to be in or will be in the state pension system for an extended period of time and will have 25, 30, 35 years of service in, you are not going to qualify for Medicaid. So know that this is not really an option for you. Now, if you're looking at planning for parents or family members and they can qualify for Medicaid, then you do need to learn about that a bit. But do know that it is for people with very low levels of income in assets and very tough to get facilities that are going to accept Medicaid patients. Not a lot of choice involved there. Generally not the best option for you, but if you need it, it's there. So the third option is, well, can we take our personal income and assets and pay for the care? And certainly if we've saved enough, as I mentioned before, we can. Some folks are out there and they'll tell me that, hey, Greg, we don't care about leaving money to somebody else. We took care of ourselves. No one left us anything. We're not really interested in leaving something to someone else. So we're going to spend the money best we can. And if we have to give some of the money to the nursing home or assisted living facility, we're fine with that. And you know what? If they're fine with that and that's their decision, that's okay. Not a problem. Others will say, hey, I didn't work all this time to pay a nursing home my retirement money or the inheritance that I had earmarked for my kids. Well, again, this is a personal decision. Really have to decide if we want to use our personal income and assets to do it, or maybe it's a combination. Maybe somebody says, all right, I've got X amount of dollars in my 403b plan or in different cash savings CDs, whatever it is. I'm willing to take some of this money, apply it toward long-term care costs, but not all of it. So through a planning process, we just have to determine really what's the best option for those individuals. Then the final option is long-term care insurance. And a lot of people ask about the long-term care insurance and, well, what does it do and how does it work? And in a nutshell, it's just like any insurance policy where it pays a benefit, different than, say, a life insurance policy or your homeowners or your auto insurance. Those tend to pay a lump sum benefit when there's some type of claim against it, where long-term care will pay either a monthly or a daily benefit for care. So it's more of a stream of money that's going to be paid out over a set period of time than it is a lump sum cash benefit option. But if you have a policy that is flexible, so this is depending upon the policy, you could use that benefit for any of those types of care that we talked about before, whether it be in a nursing home or it be at home. Long-term care insurance policies can actually pay a friend or family member to take care of us if the policy does allow for that. So one of the questions that I get with long-term care insurance is, well, Greg, isn't it really expensive? And the answer is it can be. Expensive is always relative to the person you're talking to, certainly, but there are a lot of different factors that will affect that premium, and the most important being age and health at the time of issue. So if someone comes to me and they're 73 years old and they say, Greg, I want to start talking about long-term care insurance, I'm going to politely tell them that this is really not a great option for us right now. Let's take a look at some other solutions. Because at that point, it would be extremely expensive and probably cost prohibitive. If they have enough to pay for it, the premium at age 74, then they probably don't need the coverage anyway. And then person has to be healthy as well. So just like any insurance, if we're healthy at the time of issue, it's a lot less than if we're not healthy. But then we look at all the other options as well. How long do we want that benefit to remain in place for? What's the length of the elimination period? And what that does is it will say, hey, you're on your own for the first, say, 90 days, and then the insurance company will pick up. Well, if I go back and I say, well, hey, Medicare will most likely pay for the first 100, so I could get a plan that doesn't need to pay for the first 90, it'll pick up day 91, then that's a smart option, will help you lower your premium there. We do want to have inflation protection as well, as we talked about before, because if you buy this at 52, you need inflation protection, because at 82 is when you're probably going to need that type of care. Some other considerations as well. One of the nice things in New York State is that there are some tax benefits of buying long-term care insurance. And again, I'm not a tax advisor. That's what one of those first slides told you. But there are some nice advantages that we could look at if we're in New York State and we buy a plan that is tax qualified for the state. So your advisor plus tax advisor could get together and help determine if that is the case. And in New York State, could be up to a 20% tax credit on the premiums. Tax credits are very good. Tax deductions are fine. Tax credits are a dollar for dollar return of taxes, so those are much better. You want to make sure that all the benefit triggers are very clear in the contract. You don't want to have to go back and forth and argue with the insurance company. If a doctor says, yes, you can't do 2 out of those 6 activities of daily living, we want that specified right in the plan there. We have to be able to afford that elimination period. So some people say, well, I could go with a 6-month elimination period and I could private pay for 6 months. That's where, again, we look at the assets and say, well, do we have some assets that we could utilize for expenses? And then do we want the insurance to pick up anything on top of there? And you do definitely want a financially stable company. Nothing worse than in 30 years, you get a letter stating that, hey, thanks for your premiums. Our company's out of business now, and good luck to you. You want a company that's been around a while that knows what they're doing here. So the insurance could be an option for some folks. It'll do these things for us, transfer the risk to a company, provide the care that you're looking for, because when someone has money to pay for care, you get a lot better care. I know that it's not supposed to work that way, but unfortunately, they're all businesses, and that's the way it works. And then it will protect your property and assets. And the pressure on the family is really what most people want to avoid. Everyone says, I don't want to be a burden on my family and my kids. So if you want that to be the case, no matter where you are right now, make sure you do some planning here. Make sure that you at least have conversations with somebody like myself, or an insurance or a financial advisor, and an estate planning attorney. Really get a good game plan in place, know what you want to do, and know what actions you could take in order to get there. We're here to help. If anybody needs help, you can reach out to us. Our information is on the Saney's website, so just go there, or you could just call up Saney's and they could put you in touch with somebody that's in your area that could help you out. We do have offices in every location throughout the state that you folks are all in. So we definitely appreciate the time here. We're just a couple minutes before 12:30. So if anyone has questions, of course, I'm sure you could type it in the box there and they'll be relayed to me. And also, if you have any feedback for us, either in that chat box or outside of there, there will be an email sent to everybody after this with a link to the audio presentation and video presentation as well. If you have any feedback, please let us know, because we do want to educate everybody across the state on these issues, and we could do it better if we know what we're doing well and what we need to focus on here. So with that, I'll turn it over and see if we have any questions there.
Hi, Greg. Yeah, we do have one question. And the question is, can you use a combination of these? Example, Medicare and long-term care insurance.
Sure. And I touched on that very, very briefly, but again, if Medicare will cover, and it's an if, right? But if Medicare will cover those first 100 days, it really depends on why you're in and what you have. But if they'll cover 100 days, and then you look at a policy elimination period of 180 days, let's say, and you could fund those middle 80 days on your own, then yeah, you could do that. Medicare covers 100, you cover the next 80, and then you have your policy pickup after that. That is a way for you to get a good plan in place with a lower premium if you have an opportunity to do so. So certainly, sometimes the best option is a combination of options.
Okay, it looks like that's the only question that we have so far. If anybody has any more questions that you think of later, as Greg mentioned, you can go to the Saney's website to contact your local AXA representative. And thanks very much, Greg, and have a great weekend, everybody.